Thank you for joining us.
Hello.
Hello, and welcome to the Hirschberg Foundation for Pancreatic Cancer Research webinar, Eat and Live Well During Coronavirus, Vital Tips for Our Pancreatic Cancer Community. My name is Amy Reese, and I'm the Patient and Family Support Coordinator for the Foundation. Aggie, the founder of the Hirschberg Foundation, is here too and looks forward to saying hello at the end of this webinar. I'd like to introduce today's presenter, Dr. Zhaoping Li, who is Professor of Medicine and Chief of the Division of Clinical Nutrition at the University of California, Los Angeles. Dr. Li has presented at many of our annual symposiums for pancreatic cancer. She's taught a hands-on healthy cooking class and attends our foundation events. She is always an audience favorite, and we greatly appreciate that she shares her expertise with our pancreatic cancer community year after year. Please ask your questions either during or after Dr. Li's slide presentation by clicking on the chat button at the bottom of the screen and type and submit your question. Today, we will be recording this webinar, which will be available on our website, pancreatic.org. Thank you, Dr. Li, and welcome.
All right, thank you, Amy. Hello, everyone. How's everyone doing?
Good.
All right. So as you can see, I'm not wearing my white coat. I'm actually in scrubs because currently I am on inpatient service. At the time being, I have 2 of the COVID positive patients under my care. I'm proudly doing what I was trained to do. And this is something, if we are all in together, we can do it. We can get it over and marching on to our new life. So next slides, let's start talking about how we can best take care of ourselves. And I am trained in nutrition as well. So and I'm gonna first share my thoughts with everyone, then we can get into discussions. And as far as we know, our body's most effective way to fight virus in particular, it is to have a strong immune system. And our immune system is almost entirely made up by proteins. And our immune system is very, very dynamic, meaning we have constantly turnovers and we break down some old parts and we make new parts. With that have said, we really need to provide our body adequate amount of proteins. So that is the key to make sure our immune system is in the tip-toe shape to help us to fight off the viruses. And as you all hear, and the medications are not as effective, I should say far less effective compared to the antibiotics we have for bacteria. So with that have said, we are truly calling on our own defense system to keep ourselves healthy. So next slide. If we know our proteins are important and they need to come from our diet, here are the good sources. I have shown the slides before. I just want to review. And as you can tell, food, it is a pretty good source, and particularly ocean-caught seafood. And
Hi. Oh, thank you. I was hoping for a pitch.
all right, someone's mic is live, like mine. So the other source of protein is chicken, turkey, particularly the breast meat. They are very, very dense with proteins, and we should try to get them as much as possible. And then come down to eggs. Eggs, particularly the yellow part, the white part, it is pure protein. And they're widely available. Even some of you are vegetarians. If eggs are, okay with you, and that is a very good protein source. I do want to say a few more words about those of you who only eat plant-based diet. And there isn't any plant source other than soybeans would give you your body everything you need. And what do I mean by saying that? If you are now mostly eating pea proteins, for example, or rice protein, your body cannot get everything the body needs from just pea or rice. And you really need to mix them up. Some of them are missing certain element, but it can be complemented with others. So if you're gonna take eating rice or beans, you need to alternate, or in a given day, one meal, let's say with the rice, and the other meal would have chickpeas or soybeans. You have to be mixed sources. Otherwise, we're not giving our body the best chances. The other very effective way to make sure your body's getting enough protein, it is all the protein powders and protein shakes. Particularly for those of you who have had a surgery for the pancreatic cancer, your gastrointestinal tract is not as effective as it used to be to break down food and absorb the nutrients. So the protein powders can give you high quality and high quantity as well protein, and meanwhile need less of the work from your gastrointestinal system. The best quality protein powder comes from whey protein, and that is almost identical to human breast milk. And also there are many other different ones. Even there's ones for vegan, and usually is mixed up with protein from many different plants. So that is a good source for everyone to take it as a supplement, to supplement your diet and make sure you have enough protein. Next slide. And the question is now, how much do you need? And typically for everyone, man or woman, we need at least 20 grams per meal. How much is 20 grams? About deck of a card size, or your computer mouse. That side of piece of meat usually give you 20 grams of protein. If you use protein powder, there'll be 1 scoop. So they are coming along right in their mark. If you are eating protein from animal and plants, the best is to do half and a half. So you would take advantage of the plant-based, but also you take the advantage of animal-based protein, but give your body the best balance. So that is about the protein. We can come back, discuss more. Next. Now I want to talk about the virus. Why this virus is so bad. Why this virus is causing so much trouble. As you can see, the picture of the virus, it got all those little sticky, things come out. What it does is specifically that it will stick to your lungs, not necessarily much about your nose and your throat, but really get into your lungs. There's a special receptor called angiotensin-2. You don't have to remember the name, but only the lungs have those receptors. The viruses will use those little spikes to hook onto it. And the next thing it does is cause tremendous inflammation. And what is the inflammation? Your body recognizes the virus is there, will try to fight it off, and by using one of the powerful weapons is the free radicals. And they supposedly just attack the virus, and so therefore you can kill them. Unfortunately, and those free radicals are not necessarily so focused or recognize the virus alone. There are quite a bit of collateral damages and to our own body. That is the reason you hear often we have to take antioxidant to capturing or control where the free radicals to go. So the second important thing from nutrition point of view, it is to provide our body a good source of antioxidants. Make sure it will not have the fire really grow out of control to damage our own body. So what kind of food have antioxidants? I'll look at the next slide. And the best food have antioxidants is almost entirely from plants. As you can see in the little circle, I put it all here, and they are all different shape and colors. If you ask me what is the superfood, actually the most power comes with all of them in combination, because they all can give you a little bit different weapons and they're not identical. It is much better to have a variety than you stay with, quote, one superfood such as blueberries. So the message is very clear. We really need to provide our body everything possible. I guess I can control the slides. Oh, no, next one. Oh, okay. And you can see, I'll give you a picture with vegetables and a fruit together. And they are also, in addition to the antioxidants, give you the best carbohydrate. You don't have to worry about you oversupply your body with carbohydrate, the cancer may take advantage. No, this is the most balanced, high quality carbohydrate. It also gives you the vitamins, minerals, and the special nutrients, and also prebiotics. That means will feed your bacteria, the good bacteria in your body, that can help you fight off the viruses as well. Next slide. So to really put together what we have just talked about, and as you can tell, I put it on the plates. It is very important to be balanced. And one is you're gonna have the protein, at least quarter of the plate. And then you have your vegetables and a combination of all different varieties. And then you have your whole grain starch. But that should be quarter of it, but no more than quarter of it, because you don't want to necessarily too much and to oversupply your body with carbohydrates. Next one. And then I want to talk about specifically for what we are facing today with the viruses around. And I know many of us are concerned to go out to eat. Actually, the only available way is actually taking out. So I'm putting this food safety from CDC here, but I want to walk you all through. The most important thing is not to have your hands, particularly your hand before you wash, to touch your food, touch your face, touch your nose, and touch your mouth. So hand washing, it is very, very important. So that is the first thing we got to do. You know, I have the little guy up in there, he is touching his nose. And that is not something we want to do. That is inviting the virus in. So, and some of you may wear gloves. If you wear gloves and you dispose it right away, it is okay. But it is not okay. You wear gloves, going everywhere and touch everything. Then it defeats the purpose. The purpose of washing hands or wear gloves is preventing the dirty hand or the dirty gloves to touch your face. That is the most important thing I wanted to really emphasize. The second thing is really separate out things. If someone is delivering your food, you're gonna wear gloves or use your hand, take the food out, dump the food to your clean plates, and dump the containers, wash your hand or take off the gloves, and then you can eat. So really have to separate, the containers that maybe get sneezes on or have a potential of have the virus. You're gonna just do that with your hand, keep your food not being touched to your clean plates, and then wash your hand, come back to eat. So that's the second step. The third thing is that if you feel that is much, there's another way to kill the virus. That is cook. Virus is a part of, they have proteins, and if you cook it, it will kill it. So if you still concerned after, what we talked about, simply just cook the food, either reheat it up in the microwave, or definitely you cook it at home with your oven or the ranch top, and they are definitely effective to keep you away from live virus, so you would be safe. And the next thing, may not be as effective as the cooking, is putting in the freezer. And those is cool for the food you're not gonna eat immediately. If you go out to buy chicken or fish, put in the freezer, and particularly more than a day, and that can significantly decrease the virus, decrease the virus chance to be alive and to cause you trouble. So those are the four things that are, offering for us to handle our food, not, give us chance to contact the live virus. So next. And, nutrition we passively put into our mouths, into our body. It is also, depend on other factors of our body for our body to use the nutrition. And you can see when we stressed out, and we can't, number one, we usually don't do the right thing, including not to do the proper hand washings and not to handle the food carefully. Look at the guy eating over, he's at work and over his keyboard that may have been touched, or his hand been touching other things. The other possibility is we just stress eating and we eat the wrong food, like, candy bars and everything else. That's very easy, because those sugar are so soothing. They actually have scientific evidence to show it will calm us really down. But we don't necessarily want to do that because that's not good for our overall health, particularly, for those of you, had cancer in the past. So stress is definitely something we need to handle by going outdoors if possible, not to be in contact with other people, doing some physical activities, and meditating, talk with friends. I don't think watch TV is a good idea. So we should handle stress differently, but not to take on food. And that can have negative impact on overall our body function. Next. I think next we'll talk, this is stay active. So our body would have a driver to really take in the nutrition we have eaten. And this is called active nutrition. It depends on not only what we eat, but also how our body needs them. So try to stay alone, obviously not too close to other people, and take a walk, and stay active is very important. Next. Next is also important, and that is, in spite of we have the virus, in spite of we have all the concerns about economy and everything else, and we need to take care of our own body. Sleep, it is one of the key features, and that is maintaining our body overall health. During sleep, our body goes through a repair, and also go through surveillance. And that's the time the body do the best to look at what needs to be fixed, what include bacteria and virus, what should not be here, and they will be taking care of it by our immune system. Instead, wait is too late, and our immune system get overwhelmed and cannot handle it, and that's we feel sick. So make all the effort possible and take the time, now we're all home and safe, to sleep well and give our body a good chance to stay on its best shape. Next one. And this is just emphasize again for all of us, take a deep breath, relax, only then, and we can take care of ourselves, and then we can take care of our friends and the whole society. Just like we used to get on the plane, the flight attendants always say, put the mask on yourself and before you help others. So this is that message. We need to really focus on ourselves. And that is the best thing we have in control. And that's the most effective way we can contribute to the society. Next slide. And I'm trying to put it all together in the UCLA acronym. So for you to give yourself the best balanced food, that is to try to have unlimited vegetables, you're home, you're cooking, and that's the best thing. And watch out your starch and fat, and give yourself enough healthy lean proteins, and stay active. I think that is all the slides I have. And now I'd be more than happy to answer any of the questions you may have. Thank you.
Is it possible to see all of our guests today?
I don't think many of you are using cameras. I think we can see each other. Oh, many people are now turn on the camera.
Everyone has been muted just while Dr. Li was presenting. So if you would like to speak, you can unmute yourself. It is generally in the form of a little microphone, which will unmute you, or in the corner, there should be like 3 dots that will unmute you.
Okay, anyone has any questions? First thing I want to say is that this is so nice to see all of you. Some of you I have met, and knowing you are safe and well, it is a tremendous feeling for me.
Thank you. There was one question in the chat. This is Lisa.
Hello.
Hi,
Deb.
Wendy.
Hi, Aki.
Deb Carabet asked, what if I am trying to not have much soy?
If you don't, that is perfectly fine. And I would recommend you to have a mix up of the proteins. You can get it from legumes, but just remember the legumes and has not only protein, but also starch. So just be mindful of your starch. If you're gonna have protein powders, you can have a mix. You can buy the protein powder already from mixed plant source, or you can have yourself morning have a pea protein shake, or either afternoon or the second day, I would have a rice protein, or day after have the hemp protein. So just different combinations. And the key is not to have one kind all the time, particularly you are not eating much of the protein, or you not have the food have much of the proteins.
I have a question.
Go ahead.
Thank you, doctor, for doing this. Much appreciated. I've heard you speak many times, and I'm always grateful to hear you. My question is, I am post-chemo for 4+ years. Am I still considered in a compromised immune state?
I would say probably not. I also want to share with you all about, my experience now dealing with the virus, right? If you just listen from the media, it sounds like a very scary. But here's what I'm telling you now, the first hand. We have a nursing home, on the VA ground. And there's, a few residents there test positive for the virus. What we have seen is that even they are elderly, even they have medical problems, majority of them, even tested virus positive, they don't have any symptoms. So we're more looking at about 70% of them really have no symptoms, and a third of them have symptoms. Last Friday, exactly 1 week ago, and data was made public for the nursing home up in the Seattle area. Even in that nursing home outbreak, we heard many of mortalities from that, and they now showing the data. Even there, 50% of people testing positive have no symptoms. So you can tell. That's another thing. Well, the good and the bad. The good is many of us even have not tiptoe shape immune conditions, we still can handle the virus. And that the downfall is that make it hard for the society overall to control the spread of the virus. Because most people, even have the virus, really have no symptoms. And now the scientists are really looking to really see those folks do not have symptoms, even they have the virus, if they are developing immunity, meaning antibodies. So the answer is most likely is. And even you were gone through even you were having the diagnosis and treatment 4 years ago, and your immune system and it most likely is in good shape, particularly you stay active, take a balanced diet, and not allow yourself to stress out. And those are all the things to ensure you in good shape.
And then also the second part of it is, because I agree with you and I do feel that I'm in good health and strong and I'm doing all those things that you're talking about. I'm 59 years old, and so I'm on the border age-wise. I want to know if I am able to bring food to older people and leave it at their doorstep if I want to help my neighbors.
I think that is the question, is how you're going to do it. If you are talking about you're going to cook in your house, you're going to wrap it up and you're going to go out, go to your neighbors and just drop there. And in between, you're not going to talk with anyone or touch anything. I think you're perfectly fine.
Yeah.
Okay. But if you're telling me you're going to drive to a restaurant and you park your car, you're going to go walk there, you're going to come back, or you go to a supermarket to buy things, you're touching things, and then I'm not so sure.
Okay.
Yeah.
That's helpful. Thank you.
Yes. And so now the Los Angeles mayor is asking everyone to wear a mask. that is really for the society, because we don't know who has a virus, but if everyone wear a mask, and then even those people have no symptom has virus, would have much, much less of chance to give it to other people.
Mm-hmm.
And we all have to go to places. I want to tell you the high risk area you could pick up the virus usually are elevator, buttons, and the door handles, because those are the things people touch.
Mm.
I would recommend you either carry toothpicks or cardboard strips. Use those to touch, elevator buttons.
Mm-hmm.
And if you touch the handles, either you wash hands right away, or wear gloves, or use tissue papers and not have your hand to touch it, and dispose whatever you use right away afterwards. Those are very, very helpful.
Dr. Li, we had a question in the comments that was from Brenda Lamb, and it says, do you think home sewn cotton masks are effective? Her daughter is making them for their elderly neighbors. And I know that there's been some changes with the mayor's office and sort of new requirements. So can you speak to the masks a little bit more?
Yes. So the virus, this particular one, it is mostly, get from one person to another by droplets. And the reason we say people should stay 6 feet apart is because that's usually, when you sneeze, the droplet can travel. It's about 6 feet. That's the maximum they can travel. So if you are staying 6 feet away, you're already pretty safe. If you also cover your face with a mask and not let your hand to touch the outside the mask, it doesn't matter much what kind of mask you're wearing. It would be very protective. Even you use your homemade, you wash it when you get home, you're not touching the outside, and you're washing it every day, it is just as good. The comparison about masks are more for people working in the hospital. Let's just say someone have, a lot of secretion in the throat, and the nurses or the doctors are going to go suctioning with vacuum, suctioning out. And then you generate something called aerosol. Aerosol has a smaller droplet, much smaller than we sneeze or cough. Those things can hang around in the air, and so wearing different grade of mask would matters for preventing those tiny little aerosols get to you. So if for general public, and it doesn't really make much a difference. The other thing I wanted to say is that it's very, very effective. It does not matter what kind of mask. And you put it on, particularly you're the one coughing or sneezing, that will capture almost all of the viruses, even you have it, into the mask. You're not giving to other people. So, so the mask for everyone's purpose, and any mask would work. You do not have to go all the way to the N95s or the special respirators. No, you don't. That does not really give you more than other masks. That only matters in the ICUs or surgery, and when we have to do procedures. Otherwise, it really doesn't make much of difference.
Hi, Dr. Li. This is Deb Carabet. I'm Norm Carabet's daughter.
Uh-huh.
So I have two different questions. One with trying to get my dad to eat, just even eat. He's not doing very well, and we're trying to get protein in him like you're talking about. I've tried to make him milkshakes, but unless I put ice cream in them, he won't touch any of the protein milkshakes. Any suggestions to get him to be able to eat more protein? Because even when he does eat, it's so little, and he's very unstable right now, you know, standing or anything like that. And then the second question is, we do visit him and we do the 6 feet. In fact, we do even more. The minute we all walk into the house, we wash our hands. So if we keep washing our hands, should we be wearing gloves on top of washing our hands, or just continue to wash our hands and that's actually better? Because I've heard mixed things about gloves staying, you know, keeping the germs on the gloves as opposed to just washing your hands.
Okay. So let me answer your second question first. So about the gloves and hands. If you go into his house and you're concerned to bring anything to him, and either you were wearing gloves when you get into his house, you take it off, and then wash your hand. You still need to wash your hand because you are gonna touch his stuff in his house. And you only need to wash once, unless you sneeze into your hands or you coughed into your hands. So if you think his home is clean, all you need is when you go into his house, you wash your hands thoroughly. And even you were wearing gloves, you take off the gloves because the gloves touched everything outside of his house. You take off the gloves, wash your hand, then you touch his things. If you're super concerned, I recommend you wear the mask. So you wouldn't,
We do.
when you're talking with him, the droplets come from talking will not fall on his desk or his body. So that's all the precautions you need to take.
Yeah, we do. As a family, we all wear the masks.
Yes, that is fine. So the gloves, it only matters is how you use it. I just don't want people feel, I'm wearing gloves, I can touch everything. No, because your gloves touch everything, then your gloves touch your face or other people's belongings, that defeat the purpose. Is really to remember clean space, clean environment, and that's where your daddy's house and where you just come in from outside. So separate that is the most important thing. Gloves or no gloves, okay? And then the first question you had is about his protein intake. I'm concerned because he is not even stable on his feet. I would recommend you can try use milk or whatever base, add a protein powder, add probably some mangoes or strong flavor fruit. You freeze it to make an ice cream out of the protein other than giving pure ice cream.
I've already done that. Trust me, I've done it. And when he
doesn't
finds
like
out,
it, popsicles.
my father is allergic to anything that's green or anything that's
Mango is yellow, strawberry is red.
Yeah, but it's the protein I'm concerned because I had actually brought some protein powder, made the popsicles with blueberries and raspberries and some banana because he likes all that.
How about savory flavor? Let's just say, egg whites with black pepper and salt.
I think Arlene does get some eggs in him in the morning. It's the rest of the day that we get concerned.
Okay. Here's another thing you can do is buy a chicken, use a slow cooker or high pressure cooker, cook it to the point all the meat are into the soup. And then he can drink either the soup, which the protein is already digested. Cooking is digestion, so it's already in the soup. He can drink that or put that into a fridge. And second day, you take it out, it's like a jellos. The harder it is, the more protein is in it. See if he likes that.
Okay, great, thank you.
Yes.
Does bone broth have protein?
Bone broth depends on okay, here's an easy test. Put the bone broth into the refrigerator overnight. If it come out still liquid, it does not have much protein in it at all.
Mhm.
If it come out like a jello or hard jello, like I just said, like a chicken, then you probably have high protein content in it. Just bone broth alone often does not have much protein in it.
Okay.
Dr. Li, there was another question in the chat about someone was having trouble getting fresh vegetables from the market, but they are able to sprout. So it sounds like they're sprouting seeds at home. And they're asking what the best sprouts are. So which sprouts have the most nutrients? It sounds like they're eating broccoli sprouts, but they're looking for some other options as well.
Okay. So first thing before we get into the sprout is that you do not have to buy fresh vegetables. You can buy frozen. Frozen is almost as good, and you can just go out once and buy a whole bunch and keep in your freezer. Or you kind of let it thaw a little bit when you first purchase them. You divide them into different size of sandwich bags. Every time you take out one or two to cook and keep the rest of it in the freezer. And that is one way. Now come down to sprouting. Actually, the best way is you have many different kinds to have it. Today I have Brussels sprout. Tomorrow I have bean sprout, and day after I have chickpea sprout. And that probably is the best to give you the balanced nutrient. Remember, when you're sprouting, they use some of the nutrient from the seeds to become the sprout per se. Meanwhile, the sprout would have vitamin C's and other things as synthesized during the sprouting process. So you can also think about eating the beans or the seeds. They can give you different nutrients, but it's also a good source for many different vitamins and minerals as well.
I have a quick question, and it doesn't really have to do with the coronavirus, but I'm 7 months post chemo, so I'm doing well. I have my energy and all of that, but I've developed this dry skin, and my scalp is like, I have almost like when babies have cradle cap, that weird stuff. And I'm wondering if there's something I can add to my diet. I eat very healthy, but is there something I can add to my diet that will help that particular thing?
Right, so without knowing exactly what it is, but generally I would recommend you can consider to take more cooked vegetables because they give you a lot of nutrients you may not recognize you're deficient. I would recommend you do take a multivitamin every day. Also, another thing you should consider to take is omega-3s. You can take about 2 grams or 3 grams. Read the label carefully. Often, you have to first look at the serving size. Often, it's not one capsule to give you the amount they put on the label. Usually, it's at least 2 soft gels or 3 sometimes to make up to the 650 milligrams, sometimes 1,000 milligrams. So look at that and take that can help. I would also recommend you do a total count of your protein intake. Make sure you have taken enough proteins. And lastly, I also recommend you take some tree nuts, almonds, pistachios, walnuts, and they have special fatty acid in them and can help to correct the deficiency you may have.
Okay, thank you very much.
All right.
Are there any other questions?
How's everyone doing with activity at home?
Good.
Okay.
Moving
so,
every day, almost every day.
I
Well,
live at the beach, so I get to walk.
Yes, we need to be creative at doing things at home. The major enemy for all of us staying home are two things. One is we're not active. The other one is we lose the routine we have. We don't go to bed on time, and we don't get up on time. Those are the two things not necessarily healthy at all. And if we have time at home, make a schedule every hour. Do some squats. You can use your kitchen table, any sturdy support to do the squatting, stretching, and I even recommend if you could, running on site. So that way you can get some activity. We need actually more activity when we are now home than we used to go out or we used to go to work. And the other thing is do not stay late and don't get up until noon or 1 p.m. Your body will be out of shape if you do those things. The other thing is, there's so much things we are not able to control, but you can control your remote control. So don't watch the news if that drives you nuts. And don't, look at the social media, get yourself worked up. One of the major challenge or lesson we're learning from the coronavirus is that a lot of major, I wouldn't say major, I would say a bigger part of it is we cook this thing up mentally ourselves. And that is, really out of proportions and to what we should, respond in a natural way. So those are important things we got to handle. If you actually have any questions, and you should feel free to write to your physicians and reach out by phone or even video visit. So don't just get yourself worried. Do not miss your follow-up. If you're concerned about going to your doctor, schedule a video visit, just like we are doing right now. Your doctor can see you, you can see your doctor. There used to be a challenge because Medicare does not support any of those visits. Now, because of the virus, they actually not only support it, they actually recommend people to do that. So that is something you should take advantage of.
Thank you.
I think we've come to a closing. I think everybody has had their questions. Is there anybody listening that still has a question? Okay, then in that case, my gratitude to Dr. Li for your presentation today. As usual, it was absolutely wonderful. We know that we appreciate your time and your energy, and I think each and every one of us have takeaways that are very easy to follow. To the audience, I'm heartbroken that I can't see all of you. Just a few. Wendy, Karen, I see you. But please know that we will continue with Zoom meetings until we can gather in person.
In the future, Augie, at the very, very top, there's a little box called a grid. And if you click on that, you'll be able to see everybody.
Grid?
At the very, you see 5 people right now, right?
Exactly.
If you look all the way up at the top and you run your cursor all the way as far as it can go, it will turn the top into a black line. And on that black line, there are 4 little icons. And one of them will allow you to see everybody. It's the last one on the right.
Each of you and I have exit full screen. So
Yeah.
I'm afraid to touch it.
I know. All right. Well, I'll show you another
Okay.
time when we're in the same room back in the future.
Okay. But
I'll screenshot it, Aggie, and I'll send it to you.
Great. Good idea.
okay, so next time somehow somebody's going to show me how to have a full screen. And I think each and every one of you out there know that we're here for our patients, here for our family members. The whole UCLA team will be available as we continue with Zoom meetings. And it's kind of nice that we can stay connected even though we're homebound and not able to see each other. Please keep in touch with us, email, phone call, and Amy and I are right there next to you. So thank you, everybody. It was great.
Nice to see you.
Thank you, Augie, for getting all of us together online. And actually, you are very sophisticated now using the web.
No, I'm not.
I'll see you.
Okay,
All
thank
right,
you very much.
everyone, be safe and be well.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you all.
Bye, Amy. Bye, Aggie. Love you.
Bye.
Bye, everybody.
Bye,
Bye.
Marty.
Hi, Martin.
Hey, Ani. Hi, Brinye.
Hi, hello.
Good to see you guys.
Very nice to see you. Thank you, all of you, for making
Thanks
this.
to everyone. We'll do more of these. Stay in touch.
Thank you.
Sounds good. Bye.